Welcome everyone. Good afternoon to those of you in the same time zone as me, and good evening to those of you who are in the different time zones. I think that mostly everyone is after us in time zones. I'd like to welcome you with a big welcome on behalf of the Canadian Partnership for Women and Children's Health, CanWaCH, the Canadian Council for International Cooperation, CCIC, and WaterAid Canada. My name is Helen Scott. I'm the Chief Executive Officer here at CanWaCH, and I really want to thank you for joining us today on this webinar, focusing on the critical role of water, sanitation, and hygiene in response to the COVID-19 pandemic. We all know that hand washing is the first line of defense against the spread of COVID-19 and most infectious diseases, yet millions of people lack access to water and soap for hand washing or even to basic sanitation in households and in healthcare settings. Prioritizing WASH as a foundation of public health remains a challenge, especially in this age of COVID-19. It's really nice to be connected with all of you this afternoon. We're all sort of becoming accustomed to working from home, but it's nice to be able to be together in this virtual space if we can't be together in person. And now that you've all know the name of Tina, she's going to support me to issue a poll with all of you so that we can get a sense of who's in this virtual room with us today. So the first question in our poll is going to be, how would you assess your own knowledge of WASH and health? The questions you can see on the screen right now. On a scale from 1 to 5, how would you assess your knowledge of WASH and health? Where 1 is no knowledge, 2 is somewhat knowledgeable, 3 is average knowledge, 4 above average knowledge, and 5 you are a WASH expert. Question 2 is, does your organization have WASH related programs? Where 1 is yes and 2 is no. And Tina is going to issue the poll right now. Excellent. And Tina, I understand that you can share the results. So on the screen, we can see that in our virtual room today, most of us, or the majority of us, have an average knowledge or above average knowledge, and we have a fair number of WASH experts with us here today. And not surprisingly, 75% of you or your organizations run WASH related programs. So this is great for us to all to have a sense of who we're communicating with, and also a sense that this is going to be a rich discussion based on our expertise. So with that, we're going to turn to the speakers that we have with us this afternoon. So in today's webinar, we're going to hear from 3 WASH experts who will be discussing, firstly, WASH evidence and the integration of policy for COVID-19 and beyond. Secondly, health systems, effectiveness and equity, and then some WASH rights and advocacy work. After these presentations, we're going to open up this virtual room for a Q&A, question and answers, which will be facilitated by Clarissa Brocklehurst, who is also a WASH specialist, a WaterAid Canada advisor, and adjunct professor at the Water Institute from the University of North Carolina. So it's my pleasure now to firstly introduce our original speaker, our first speaker, Helen Hamilton, who has a great first name. Helen is a senior policy analyst for health and hygiene at WaterAid Canada. Over to you, Helen.
Thank you very much, Helen. So I wanted to open by saying that obviously at the moment we're all talking about the importance of hand washing, and we're hearing a lot about it. But certainly from the WaterAid perspective, discussion on WASH has been sorely missing. So my presentation is going to highlight the importance of evidence-based influencing for WASH in the COVID-19 response. I can have the first slide, thank you. So the key messages that I wanted to start with are taken from a WHO messaging that was shared a couple of weeks ago on a sanitation and water for all presentation. So first of all, that obviously frequent and proper hand hygiene is our first line of defense, particularly where there are shortages of PPE, but even where PPE exists, it's still absolutely critical. Existing WHO guidance on safe management of drinking water and sanitation services still applies to the COVID-19 outbreak. However, I think it's very important to acknowledge that without access to water, critical practices such as hand washing, cleaning of surfaces, they're just not possible. And then the WASH COVID response really emphasises both the need, the serious gaps in WASH, as well as the increased urgency that we need to act upon. And then the co-benefits that will be realised through Good WASH will help to prevent millions of deaths each year caused by other infections, which is especially important when we know many other health programmes are currently being paused during this response time. And then finally, it's important to influence and share lessons as the response progresses. So this is especially important for WASH investments and action, which need to be fundamental to all the response plans. So moving on to the global data and evidence. So we know that 785 million people are without clean water close to home. 2 billion people don't have a decent toilet of their own. And as many of you WASH experts on the call, I'm sure are aware, 3 billion people don't have hand washing facilities at home. The healthcare facility statistics are similarly stark. 1 in 4 people lack basic water services, which affects 1.5 billion people. 1 in 5 people have no sanitation services at their healthcare facility, affecting 1.5 billion people. And 4 in 10 healthcare facilities don't have hygiene facilities at their point of care. So just to touch on the COVID WASH evidence from the WHO side, there's no reports to date of fecal oral transmission of the COVID-19 virus. And similarly, there's no evidence that other surrogate human coronaviruses are present in surface or groundwater. And then lastly, it's a relatively fragile virus in the environment, and effective inactivation can be achieved within 1 minute using common disinfectants. So now on to the equity and inclusion side of things. So I think it's first of all important to note, particularly as a Brit, that the equity and inclusion impact of the COVID-19 response has been well recognised within the Canadian response to date. And I'd like to particularly touch on the impact for women and for marginalised groups. So we know that gender inequality is exacerbated in health emergencies and crises, so it must be tackled in all response efforts. Because of gender divisions within labour, it's women and girls who will have to collect extra water within the COVID response, and similarly perform more labour and do more caring for people who become sick. And another example of the impact on women would be that an estimated 70% of the global health and social workforce are women. So as frontline health workers increase pressure and exposure to the virus, often with little personal protective equipment, this is going to be in the context of that 55% of healthcare facilities in least developed countries lacking basic water supplies. And similarly, on the impact for marginalised groups, marginalised people will become even more vulnerable during this crisis. So if we consider slum dwellers or people with disabilities, while people with disabilities are often already experiencing social stigma and exclusion based on their disability, including from WASH services, their health and social inequalities that they already face will again be intensified within this crisis. And again, I'd like to commend Canada in taking the gender-based approach to its response domestically and internationally. For example, the response from Minister Gould's statement on how to apply this to WASH, and also the readout of her conversation with Dr. Tedros from the World Health Organization. So on to the policy agenda. So as I highlighted at the beginning, we currently have this, probably more than I've ever seen before, huge focus on hand washing. And the critical point for us is to transition that into calls for sustainable WASH access. We know that historically the pursuit of population hygiene outcomes and linked public health imperatives have been the most transformative and sustainable drivers for WASH. So we really need to focus on that aspect. And the COVID-19 crisis is a real, it's going to be a critical driver in terms of creating a significant moment to advocate for universal access to WASH. It's going to be very important that we take a phased approach, especially with our influencing. So that's recognising that the short, medium and long term, we will need to continue efforts to build resilient systems. And obviously in the current context, there's an immediate need to respond to the priorities of key decision makers, but also to use this as a response to anchor wash in medium longer term action so that we can drive accelerated progress on this issue. And I'm sure it's very obvious to all of you, but it's absolutely critical from our perspective that we both support governments but also work to influence them concurrently. And similarly, that we utilise existing and new opportunities for WaSH commitments. So for example, given that a lot of my work focuses on WaSH in healthcare facilities, utilising the WaSH in healthcare facilities resolution that was passed by the WHO last year. So moving on to the systems side of things, I just wanted to highlight that limited access to WaSH will invariably lead to disparities in access to WaSH, and that we need to address key systems barriers. I'm conscious of time, and I know Clarissa is going to touch on this, so I'm going to move on to the takeaway messages. So, as everyone is moving so fast at the moment, I think it's absolutely critical that we're mindful and thoughtful while we're responding, and we really work to bridge that short-term emergency response with long-term sustainable WaSH system strengthening. We need to share lessons with each other on what's working and what doesn't. Be you a WaSH expert, a health expert, a nutrition expert, a gender expert, we need to be sharing lessons across our different platforms and communities. We need to continue to influence policy during the response and recovery and build resilience into future outbreaks. These next 2 points for me are absolutely critical in terms of Canada's voice and leadership for gender equality for WaSH, which is fundamental within the next 2 takeaways. So we need to highlight inequalities in the impact of this crisis and what can be done to strengthen the response on gender and for marginalised groups. And we also need to champion actions and investments to really embed WaSH in the COVID-19 response. As the world is facing this unprecedented crisis, we know that hand washing in particular is absolutely core, but that wider absence of WaSH is going to hinder our immediate and longer term response, causing more suffering, more marginalisation, and more mortality. It's absolutely critical that I just want to conclude on this point that I heard on the SWA webinar, that WaSH is a no regrets intervention, and that's the core reason it needs to be embedded in what we're doing today. Thanks.
Thank you, Helen. That was a lot of information, and I really appreciate how you laid the foundation for this webinar with sort of the data and the evidence, as well as the key policy needs in order to fight COVID-19. So now I'd like to pass the podium over to you, Janet. Janet Hatcher-Roberts is the co-director of the WHO Collaborating Center on Technology Assessment, Knowledge Translation, and Health Equity. The organization is currently undergoing a redesignation, and it sits at the Brocklehurst Research Institute at the University of Ottawa. Over to you, Janet. And Janet, you just have to take yourself off.
Thanks, Helen. So there are 3 points I hope to make in this presentation. And the first is to understand the context of systems, equity, and evidence in relation to WaSH and health. Improve understanding as to why systems thinking is important for effective health and WaSH strategies. And then a little bit around opportunities and complexity of intersectoral collaboration to promote health and WaSH programs and policies. Next slide. So how do we understand what we're doing? Well, how are outcomes measured and recorded? Are they based on just results or true effectiveness of the intervention? And what about equity effectiveness? We rarely talk about that. How do governments and implementing agencies measure and record success, outputs, outcomes, results? But rarely do we really understand effectiveness. Although we may hear about something as effective, it's really not really measuring it. Next slide. So when we look at the evidence often comes from research, and on the right-hand side of the poll are the positive findings, the left-hand side are the negative findings, and we tend to take the average or the mean and say this intervention works. We rarely look at the populations for which this intervention is not responding. Who are they? Who are the most vulnerable? Are they women? Is it rural? Is there an education component? Is there a poverty component? These are issues that we need to take into consideration when we're looking at equity effectiveness. Next slide. So we also need to think beyond the intervention, and Helen certainly alluded to this, in terms of the social determinants of health, because they're really crucial for the understanding of health inequities, and they hold the key to finding lasting solutions to mitigate the social problems that will allow WaSH interventions and health interventions to be sustainable. And increasingly, these complex systems demand multi-sectoral collaboration beyond what we think is the health system to address inequities. Next slide. So what do we mean by equity? Well, equality means everybody has the same opportunity. Equity says, well, some people need more opportunity than others to achieve the same result. The reality is there's always people of privilege. And also we need to understand that some people can't even take the opportunity of that intervention because of other social inequities. Next slide. So we need to understand the complex context of health systems. Next slide. So what that means is shifting our thinking to the whole, to relationships, to processes, to networks, to intuitive thinking, to synthesis, and most importantly, non-linear thinking. Next slide. This is just a picture of a complex subsystem of medicines and technologies in Tanzania a while back, but it sure hasn't changed, with the left-hand axis being different governments and points of access, and all the different layers of governments and bureaucracy and distributional networks to get down to that one person. The building blocks are increasingly fragmented, and we need to consider this complexity. Next slide. And in order to do that, we've come up with different models for what a system would look like within this complexity, with the different building blocks of human resources, health financing, the interaction of evidence and research for data and decision making, the interaction with that with service delivery and institutions and community-based services, but supported by two pillars of the social determinants of health, and also the consideration of the impact of policies outside the health sector on all of these different building blocks for health, supported by a healthy and strong civil society to keep everybody's feet to the fire, and a transparent and accountable public health sector. Next slide. So you've talked and heard about some of the building blocks for the systems approach to WaSH. Next slide. So what I tried to do is overlay some of those building blocks onto the health system model that we use. And there's a great deal of similarity to the elements and systems approach. And I think we really need to think, at least within our two sectors, how do we integrate and coordinate with each other in these important building blocks that we're working with. Next slide. So what are the barriers? Well, one of them is the decentralization of planning. We want a continuum of a health response, and yet we start at the national level, we move to the local level, we collect data, we analyze at the national level, we develop interventions at the national level, money remains at the national level, as do policies, and yet there's very little capacity for local needs coordination. And if you keep pushing the button, there's a number of programs like Gavi and IAVI that land on that continuum of a health response and weigh on that, and the ability for local needs coordination for all of us becomes extremely difficult. Next slide. So there is a need for intersectoral collaboration, and that's the second barrier, is that this rarely happens with all of these sectors. They're not always aligned. We're not always speaking with the same agenda. We have trade, we have agriculture, we have labor, we have human rights we're going to be hearing about later, migration, security, environment. They all come to play on whether or not we're going to have sustainable approaches to WaSH and health systems. And push the button one more time. And we need coherence in all of those agenda and not be conflicting with each other. Next slide. And so many of you have seen this slide of all the different donors that which is the third barrier, I feel, because there's so many competing agendas, so many different interests, requirements from all of the NGOs and governments implementing these strategies with different measurements, different requirements, and the demand on those scarce and talented people in each of the countries to address all of those needs. And we need to really think about how to simplify this. And during a crisis, this need becomes even more necessary. And next slide. I want to thank you for this. And I found this quote the other day, and I thought it was quite excellent as we think about being caught off guard, the impact of inequality and inequity, and the whole role of globalization and the impact that's having on all of us. Thank you.
Excellent, Janet. Some really key considerations and information there. The three takeaways that I had from your presentation are that we need to look at how we examine our successes through evidence. And we need to ask ourselves, are we sure that the effectiveness that we see is being distributed fairly? And noticing or remarking that COVID has heightened everyone's awareness on the complexity of dealing with a pandemic. The systems interact and they clash, and yet they're also synergistic. And I just want to note that I'm impressed that you and Aaron were able to coordinate that presentation so well. So good stuff on the technology side there.
Thank you, Aaron.
Well done. So Al-Hassan, Adam, we're going to turn it over to you now to piece together everything that has been said. We want to hear from you around your work looking at rights and advocacy. Al-Hassan Adam is from the he's the International Coordinator for End Water Poverty. This is a global civil society coalition that campaigns to end the water and sanitation crisis. With a diverse range of members, this coalition is united by the common goal to end the water sanitation crisis for all. So over to you, Al-Hassan.
Thank you. Can you hear me?
Yes, we can. I can.
Brilliant. Okay, so End Water Poverty, we are a coalition of over 160 organizations with present in about 92 countries. Next slide. So why do we focus on human right to water and sanitation? Basically, we think that human rights to water and sanitation gives the citizens the right to demand that the government provide the services to them. And these are in not just within policy, but they are fundamental human rights enshrined in UN resolutions, as well as what we call international laws. Next slide. Now, within the human rights work, we have 5 major principles, which are sustainability, freedom of information, accountability, equity, non-discrimination, participation. You had a couple of reference to equity from Jeanette's presentation to that of Helen and stuff. And basically, these are human rights principles. And I don't think anybody on this call or this webinar would disagree with me that these are not relevant stuff that we should all hold our government accountable on. Next slide. Now, these principles sometimes are difficult when you come to service provisions like water and sanitation. So we have what is called the normative values. That is when you are providing a water or sanitation services, what values are we looking into? How are they going to deliver? A, the water should be affordable, it should be accessible, it should be acceptable, and it should be available, and the safety and quality should be guaranteed. So these are the benchmarks for service provision. Next slide. Now, which are the conventions, the UN conventions that we rely on in terms of human rights to water and sanitation? We rely on 1, the elimination of all forms of discrimination against women. It has explicit stated there that water and sanitation are human rights, the rights of the child, and the rights of persons with disability. With this conventions, it means that any country that have signed on to this convention, including Canada that has signed on this convention, citizens in these countries can take their governments to court if they refuse to provide the services. Next slide. Now, in EWP, we run a couple of campaigns, and I'm just going to run through our current campaigns. Next slide. It's called Claim Your Water Rights. And we launched this campaign on the 10th of December 2000. Yeah, next slide. We launched this campaign on the 10th of December 2019 to coincide on the International Human Rights Day. And so far, since we launched this, our social media reach has gone up by 77%. And we have 16 of our members have joined the campaigns from different countries, 12 countries in total. You would see Benin, France, India, Madagascar, Nigeria, Pakistan, South Africa, Spain, Tanzania, Zambia, Ghana. Yeah. Now, these members, they have organized a number of activities ranging from interactive radio shows, press conferences, Twitter, Facebook Lives, and community meetings, and all geared towards interacting with service providers to raise the issue of access to water and sanitation in these various countries. Next slide. Now, these are a couple of photos of the actions that were taken, and that's a mobilization in Africa from Tanzania to Nigeria to Zimbabwe. Next slide. And then we have Asia, mobilization in Asia, signature campaigns, marches. This was just about a few weeks, 2 or 3 weeks before the countries decided to go through lockdown. So these were just at the cusp of the outbreak of the coronavirus. Next slide. And then we're working with Leo Heller, who is the UN Special Rapporteur on human rights to water and sanitation on this issue. And we have a BBC journalist who also did a very interesting documentary on Detroit water situation called Lena Jose. She's really, really remarkable documentary maker. And then we have WaterAid country programs and Greenpeace. And the shot there was a discussion in London when she was, the BBC journalist was launching her documentary on Detroit. Next slide. Now, when we launched this campaign, people in different countries started using these tools, and basically what we're asking them to do is to go to the Human Rights Commission or to the service providers or write to their MPs if there's no access. And this is a community in Zambia made up of 30,000 people in the community, and their MP is the health minister of Zambia. And when our members went there to do this program, when he saw it being broadcast on the TV, he basically went back to the community to say, I'll fix this in 5 days. And within 5 days, the MP went and fixed the water situation in that community. But interesting enough, he had promised them fixing this situation during election. And 9 months after election, he never bothered to go back to the community. So this is like a way of working community with radio stations and TV stations, implementing their kind of expanding the community's voice to get to the duty bearers. In this case was the Minister for Health. Yeah, next slide. And then this is in Nigeria. We campaigned with our members in Nigeria in Enugu State to get the Enugu State to declare a state of emergency for sanitation. And this is way before coronavirus outbreak. And in the same state, in the abattoir, they had their water system not running for a number of years. And then they were using a kind of dugout hole to get water for the abattoir. And this is like a public health issue. We got there, we got our members there. They got onto social media, promoted the issue on social media, and they got a result. And this is for us was fantastic. Yeah, next slide. Yeah, so right now we have a call that we are calling on governments to provide sanitation workers, especially for protective equipment, provide them with sick pay, permanent contracts, and universal salaries. Now, this is important in the face of COVID when these guys are working without any protection. Next slide. Now, there's a call that we are launching on the on 1st of May, which is calling on ban on disconnections of water services to households and restoring of water services to households who have been disconnected, and then absorption of water bills for those who cannot afford during this period, and subsidizing water utilities to settle unpaid government bills and track water to rural communities who are not connected to central water supply systems, and deliver safe water services to public spaces, health centers, homes, and prioritizing informal settlements, low-income households and care homes, prisons and refugee camps. So these are things that we're going to call on May Day for a global sign-off and then rally our members. The results of this will be presented to various countries in different countries, and also as well as to some international bodies like UN Water and WHO and others. Next slide.
Al-Hassan, are you wrapping up?
Finally, yeah, I'm wrapping up. That's my last slide. And what have we learned so far? We've learned that human rights, campaigning on human rights is quite powerful, but what you need to do is to give a lot of time for one-on-one training with members who are going to use this. And there are National Human Rights Commission in every country who are ready to pick on issues on water rights and run with it. Thank you.
Thanks very much, Al-Hassan. Thanks to all of the panelists for their presentations. My name is Clarissa Brocklehurst, and it's my pleasure to come in here and ask a few questions of the panel, and then also put to them some of the questions that participants have been putting into the Q&A box. So my first question to the panelists is it tries to look on the bright side. I think that you've done a very good job, the three of you, of outlining some of the huge barriers and obstacles that we face. Water, sanitation, and hygiene are key to health in general, COVID in particular, but they tend to be neglected. We see that from the statistics that Helen talked about in healthcare facilities. It's shocking. Systems are complex, and we tend to work in silos, and we don't work well across sectors. And the outcomes that we produce are not always equitable. But there's also opportunities here. So I'd like to know from you what you think are the greatest opportunities we have in terms of working together, for instance, across the WaSH and health sectors, to ensure that everyone everywhere is safe from this disease. So I'm asking you to be optimistic. Who wants to go first?
I'll go first. It's Jan.
Jan?
Yeah. So I think if I had a magic wand and I was able to say, do this, I would say I'd ask each of our major donor, like DFID or GAC, to sit down, and maybe they've done this, and ask each of their sectors, what is the contribution that needs to be made in order to deal with this issue? So it's everybody getting together to say, this is how we'd like to see this investment envelope managed and implemented. And that they don't forget about sectors that will have an incredible impact if we don't consider them. And then that there's very much like how the HIV and AIDS community dealt with this with these community coordinating committees, that at the national level, there is a community coordinating committee for COVID that brings the sectors together and the donors together around the table to say, and what are you doing? What are you doing? What are you doing? And this is how we need to work together. It's possible to do that. We've seen that through the HIV and AIDS time, and it worked very effectively in terms of coordination and cohesion. So those would be my two things.
So you see the role of donors in particular in convening and breaking down the barriers. Helen,
yeah.
Come to you next.
Sure, thank you.
I thought I could see you smiling, so I was assuming.
Yeah, a lot of agreement with what Janet was just saying. I really, I do think there's a real moment here to find common ground, and in particular common language between different sectors on what it is we're trying to achieve. And obviously in the Canada context, equity and inclusion is absolutely at the heart of what we're all trying to achieve. So really making sure that we're clear around what we're coalescing on and what our shared objectives is. I do quite a bit of work within the neglected tropical disease sector and the intersection with WaSH, and that's been something that's been really fundamental to driving better sort of integration and coordination and cross-sector working. I think the second thing is to find and share practical examples and evidence of what's working to bring sectors together, and it can be outside of your own sector. So for example, in this context with COVID-19, it could be which platforms for umbrella hygiene and behaviour change campaigns are working. A call out to the health sector people on this call. At the moment, and even after the COVID crisis has passed, we need you to help us champion WaSH as foundational to public health, because particularly what we're seeing in the COVID crisis at the moment is WaSH is not always being routinely included in discussions on planning and so on in the response. So we need advocates who are already in some of the conversations to highlight this gap. And then just my final point would very much be to agree with Janet. Clarissa, I would agree with Janet. On the funding issue, I've seen lots of examples on sort of major investments that have served to bring different sectors together. So if working in a coordinated way is mandated through your grant or investments that are made across sectors, that gives it a chance, that cross-sectoral approach to embed and for people to see the value and get into a working rhythm. So I think it's really important that the COVID-19 pandemic serves as a catalyst for urgency and ambition to embed WaSH as a foundation of public health in Canada's development assistance priorities in particular, because it will then set the stage for that recovery opportunity to really embed WaSH systems thinking in what we're doing on health and preparedness as well.
Thanks very much. Great. Al-Hassan, do you want to add to that?
Yes. For me, I mean, this pandemic has just shown that we have underinvested in water, and now there's no excuse not to invest in it. Because we kept hearing the question, people saying, oh, there's no money, but it's not really true. With this current pandemic, we've seen how much has gone into also financing businesses, which if you compare what is needed in the water sector is just ridiculous amounts that is going out into financing businesses to making sure that they don't go under. And if that amount is put in water, which from Helen's presentation, the quote from WHO, there's no regret in investing in water. And for me, this is the time those of us working in water have to speak up and speak out strongly about the investment in the sector. And we should not mince words. Let's be strong on this issue.
Yeah.
We should not be caught unaware again.
I think the expression is caught with our pants down. So I hear very similar things from all three of you, and that segues in nicely to my second question before I turn to questions from the panelists. And that is that it's specifically about the role of Canada. And Helen, you've touched on it a bit. The Canadian government has made it clear that Canada will provide aid to developing countries to overcome COVID-19. Minister Gould has already made a statement about this. But certainly from my perspective, I find that those statements are glaringly lacking any mention specifically of water, sanitation, or hygiene. And we know from experience that the government's feminist international assistance policy, which many of us welcomed, was also disturbingly silent on the issue of water and sanitation, even though it has such huge gender equality components. So what advice would you offer to Global Affairs Canada regarding what Canada specifically should do in terms of water, sanitation, and hygiene, both to battle this pandemic, but also to prepare the world for the next one so that we're not caught with pants down again? And I'm going to ask the three of you perhaps, or a couple of you, to make quick interventions. And then I know we also have Brian McDonald from WaterAid Canada on the webinar, and I'm going to ask him to speak quickly to this as well. Shall I go first to Brian, or Helen, do you want to come in? You've already outlined a few ideas.
Certainly. I think Brian will probably cover off the main points, but I wanted to emphasise from the UK experience, one of the things that we've seen is just the critical nature of embedding WaSH in health programmes, as well as having a twin track of specific WaSH funding. And I think you'll need both parts. And then also just the importance of funding for, ring fence funding for coordination and those other areas. But I know that Brian obviously has a much better understanding of the Canada context, so I'd like to pass across to him.
Yeah. Let me turn
to
Helen now. Ryan, are you there?
Sorry, yes, I'm here. Thank you, Helen and Clarissa. So offhand, I'd certainly see probably 3 avenues of action that I might recommend here. I think certainly in the short term, as we've been touching on already, dedicated specific funding for a preventative approach to COVID, I think is a major step or a major action that could be taken. And this would cover hygiene promotion, also access to water, cleaning for healthcare facilities, support to workers there, and really recognizing that they play a critical role on the preventative side as well. I'd also say prioritizing these interventions to those at greatest risk, dense populations, remote areas. I think that's really key. And also female-dominated occupations, such as health workers or caregivers. Moving beyond that, I think this crisis also gives a long-term or larger opportunity really to more firmly place WaSH at the heart of Canada's foreign assistance interventions. So I would certainly see the development of a WaSH strategy as a key aspect that global affairs could initiate. I think, as you rightly noted, Clarissa, while the Feminist International Assistance Policy contains a lot of great ideas and approaches, the particular focus on WaSH could be developed further, and so this could often, I think, could serve as a supplement to that. I would recognize the role of WaSH in healthcare systems, but also linked to broader health outcomes. And then in addition to that, operationalization of such a strategy via funding, integration into future calls, as well as across different tools or proposal templates, scoring procedures at GAC, I think would also be a welcome addition.
Okay, thanks very much, Brian. Does any of the panelists have anything they want to add to that question? If not, I'm going to go to some of the questions from participants.
I just wanted to say that I think that one of the areas we could come together on is to invest in district level planning and capacity. So if the districts own their data, they understand it, they can better ask for resources. And WaSH always emerges as a priority at the district and local level, but we don't invest, and GAC has not invested a great deal in that capacity. And so if we did that, then you've got the prevention and the treatment, but within each district, you've got the ability and the flexibility and the surge capacity to react because people know what they're supposed to be doing, and they can ask and put pressure to get those resources. Thanks.
I think that segues in quite nicely, Jen, to one of the questions that has come through about the balance between simplifying a fragmented response, you know, having a very streamlined response, but also, on the other hand, ensuring diversity that comes with locally appropriate solutions. And I think further to what you're saying, also sort of locally owned, locally governed, locally managed solutions. So I'm not sure if any of you have things that you would like to say about that. How do we balance that? How do we balance the big, mega, streamlined, maybe at national level solution versus the idea of working at a lower grassroots level, but with a very fragmented, inevitably fragmented response?
Well, this is like a very big. Hi, can you hear me? This is Al-hassan.
Yeah.
For me, this is a really big topic we are opening now in terms of national versus district and stuff like that. But for me, fundamentally, it's about central government commitment that there is funds for district level investment now, and that the donors put in the money within that fund. Because we are seeing fragmented donor projects in countries, and then you have fragmented NGO projects in countries, with all the systems don't speak to each other. Now, the problem of managing at local level, sometimes when you run community projects which do not have budget from central government, is a problem. Then it becomes the issue of a community to make sure that they run the system properly and do cost recovery, repairs and operations and maintenance. Is just too much for a community. When you and I, we're not bothered with day-to-day management of the water system that we rely on. But you want some poor community members to be doing that, aside looking for livelihood for themselves. And I think sometimes those type of operations are not realistic, and we would always be going around running down the systems. So I think the centrality of central government, putting investment and making sure that they build the capacity of the district level is very important. And donors putting in their money into a global fund for water. So for instance, we have global fund for medicine and stuff like that. That's the kind of thing that we need for the water sector, where the Canadian government can put its money there. And then we know that this fund will be managed properly.
I think that opens a whole can of worms about global funds. But your point about building local capacity, I think that echoes very much with what Jen was saying. I'm going to include quite a very Canadian specific question right now. I think one that goes to the heart of some of the issues that we have here in Canada about achieving certainly the SDG 6, Sanitation Development Goal 6. So the question is, what are the differences in advocating for sustainable water sanitation and hygiene in the global north and the global south? And of course, many people on this call will know that Indigenous communities in Canada, for example, have very poor water supply and sanitation systems, and we know that they are very much at risk from COVID. The same has happened in places like Flint, Michigan. So what lessons are transferable? What barriers are different?
Hi, can I just jump in?
You can jump in, and then I'm going to go to
right.
the others.
For me, water system is one technology. If you look at it, it's about transporting water to people in their household, and it comes 2 times. Right. Now, I don't think that there is any system that has remained fixed like water for centuries. So for me, it's a political question sometimes. It's not financial question or technological question. It's about prioritization of certain communities. Their right has to be respected. And I think this is what a lot of governments are failing to do, to understand that the right of every single person is important, even if they don't have the political voice or the political power to get you out of office, but their right should be respected. And for us working on human rights, this is how we see it. It is the question of prioritization. If you have high-rise buildings, you can supply water to high-rise buildings, to penthouses, and then you have a rural community, you can't supply water to them. It's shameful. And for me, that's the whole thing. It's not about lack of money or lack of technology. It's the lack of political will to address this, and we have to challenge it.
And we certainly saw that. I mean, you're talking about Flint, Michigan. Detroit had 3,000 people that had their water utility cut off. So there's the water's flowing, but the spigot is turned off because they were unable to pay. And then in more northern remote communities, there may be water, but the piping is insufficient, and or there's no money to pay for it. So I think that from an advocacy point of view, it's very similar. And what's driving this inability to achieve that right are the inequities, whether they're here in the north, in the United States, or in the global south. I really do feel that the elements are the same, and the advocacy theoretically should be the same based on human rights principles.
Thanks very much to all of you. We're not going to be able to get to any more questions from participants. Some excellent questions coming through there, quite challenging questions for our panelists, I think. Just before I hand over to Helen Helen Scott to finish up, I just want to summarize what I think are the important takeaways that have come out of this conversation. I mean, clearly one of them is that water, sanitation, hygiene are essential foundations of public health. Improving them is a critical no regrets action, which should be a major part of Canada's COVID-19 response, as one of the panelists has said, embedded in the response, both here in Canada, but also in terms of its support to developing countries. And what I hear from all of you is that there's a huge opportunity here to work across sectors to bring down these silos. And in fact, we can't succeed unless the health and WaSH sectors work together. There's huge opportunities here to be synergistic, to like a long-term systems approach, not just based on short-term emergency interventions. This is the time to scale up investment in better and stronger WaSH systems so that we protect people now, but we also put in the systems that should have been there in place to stop COVID-19 from being such a threat, particularly to the poor and vulnerable. And that Canada has a huge role to play here, particularly in leadership in terms of gender equality. And I think I heard this coming out over and over again. Given the many risks, the many vulnerabilities that people experience and the human rights issues here, that Canada's voice on rights and gender equality in particular is important, and that water and sanitation are an excellent place, an excellent intervention if you have a priority when it comes to maternal and child health and to gender equality. So I'll stop there and turn back to Helen Scott for her final words.
Thank you very much, Clarissa, for those excellent key points to kind of wrap up and summarize our speakers' really insightful contributions today. On behalf of WaterAid, WaterAid Canada, CanWaCH, and CCIC, thank you to all of the participants for taking the time to join us this afternoon. And I'm so impressed with the engagement in the chat room and the conversations and the excellent questions that were asked. I also just want to pass along my thanks to the CanWaCH team, Aminata, Tina, and Erin, Megan, those of you who are running the technology in the background, thank you very much. Once again, we'll be sharing the recording and the resources from this webinar after the webinar. We welcome you to reach out to us if you have any questions or if you want to connect with us about anything further. Our email addresses are on the screen right now. And we encourage you to stay tuned for next week's webinar, which is focused on mobilizing for Menstrual Hygiene Day. It will also have simultaneous translation in French and English, and the registration details will be included in tomorrow's follow-up email. Thank you very much, everyone, again for joining us, and have a wonderful afternoon or evening, depending where you are.